Mandates, protests, truckers, vaccines, lockdowns. There's been a lot going on in the last couple of years and a lot of controversy and conflict. But one thing that's written down in black and white is Pfizer made a hell of a lot of money. How did that happen? And should it keep happening? Hello there, you 5 million miracles. Welcome, welcome. Come on board. No labels, no judgments here. Let's openly discuss what's going on in this crazy little world of ours and see if we can't come to some proper conclusions democratically. Now, it's been a fantastic pandemic for Pfizer. They've made $40 billion of profit. And at a time where misinformation is being discussed everywhere, where there's cynicism, skepticism, doubt, and a very powerful campaign to bring down a podcast host on the basis of misinformation, where is the scrutiny and analysis when it comes to the business practices of Pfizer? So let's see what kind of precedent has been set by putting pharmaceutical companies, big business, in charge of global health issues. This is by Nick Dearden, Director of Global Justice Now. Pfizer has had an exceptionally good pandemic. Today it was announced that its COVID-19 vaccine brought in $37 billion last year, making it easily the most lucrative medicine in any given year in history. That isn't all. For a company that was until recently the least trusted company in the least trusted industrial sector in the United States, COVID-19 has been a PR coup. Obviously, we're mostly in it for the trust, but the $40 billion is also very much appreciated. That's amazing to think that before the pandemic, Pfizer were the least trusted company in the least trusted sector. It's hard to imagine a company that is trusted less. But now that's all changed. And as a little bonus, 40 billion of profits. Pfizer has become a household name over the last 12 months. They spend enough on advertising. The US president referred to Pfizer's chief executive, Albert Bourla, as a good friend, and the great man parked his jet next to Boris Johnson's at last year's G7 summit in Cornwall. When I read a paragraph like that, I don't feel reassured about the global political landscape when I hear about jets being parked next to other jets and presidents announcing heads of big pharma as friends. The global vaccine rollout has created levels of inequality so great that many call it a vaccine apartheid. Pharmaceutical corporations like Pfizer have led this rollout, setting the terms by which they sell vaccines and deciding who to prioritise. Right from the start, Pfizer was clear that it wanted to make a lot of money from COVID. That shouldn't surprise anybody. It's a business. That's the imperative, the incentive, the agenda, the objective of big corporations. But it seems to me that in certain matters, the profit incentive needs to be mitigated in alignment with different ideological considerations, morality, ethics, responsibility, and perhaps this is one of those. The company claims that its vaccine costs just under £5 per dose to produce. Others have suggested it could be much cheaper. Either way, the company is selling doses at a huge profit. The UK government paid £18 per shot for its first order and £22 for its most recent purchase. That means the NHS has paid a markup of at least £2 billion, 6 times the cost of the pay rise the government agreed to give nurses last year. Okay, so that's an interesting way of quantifying it and comparing it. 6 times the pay rise that the government agreed to give nurses last year. Now, for all the popularity that Pfizer has gleaned, rightly or wrongly, for the development of the vaccine, in your attention, in your opinion, what is more worthy of that £2 billion? There was a point where all over the world, nurses and health workers were regarded as heroes. Now some of them don't want to get vaccinated. They're being vilified again. And at the same time, the president of Pfizer is parking his jet next to prime ministers and being lauded as a best pal by the president of the United States. So it's pretty clear from that where the priorities of our leaders lie. It's been claimed that the company initially tried to pitch their medicine to the US government for an eye-popping $100 a dose. Tom Frieden, a former director of the US Centers for Disease Control and Prevention, accused the firm of war profiteering. Pfizer has sold the vast majority of its doses to the richest countries in the world, a strategy sure to keep its profits high. If you look at its global distribution, Pfizer sells a tiny proportion of its vaccines to low-income countries. By last October, Pfizer had sold 1.3% of its supply to COVAX, the international body set up to try to ensure fairer access to vaccines. So if, for example, you're saying, well, the president of Pfizer should be treated as a hero and park his jet wherever the hell he wants. This vaccine has been a solution to a global pandemic for which there was no other way out. Well, if it is a philanthropic and altruistic agenda that underwrites this entire project, then the distribution of the vaccine should reflect those values rather than the relentless pursuit of profit. As long as the profit motive exists as a potential reason that big business and the media and the government are operating in a particular way, then it's difficult for a cynical and skeptical population not to suspect that the whole reason might be the pursuit of profit, that there might be vaccine recommendations for certain portions of the population, i.e. if it's really vital to get it to 5-year-old kids in rich countries, Don't you think 30-year-olds in poor countries should get it? No, those 30-year-olds in poor countries are fine. But these 5-year-olds over here, they should probably get vaccinated. Are you sure? Are you sure that you're just looking at this from a purely health perspective? This is one of the problems that is systemic. So I'm not vilifying any particular policy or any particular medicine or any particular company. I'm saying that as long as you have that agenda, you might get hypocrisy and contradiction and mistrust. Pfizer wasn't selling many doses to poorer countries. Everybody's got to be vaccinated as long as they're rich and we can profit from it. Everybody's got to be vaccinated as long as they can afford it. Sir, could we get some vaccines? Let me just look in your wallet. Yeah, actually you can. And what about us? Get the fuck out of here. But neither would it allow them to produce the vaccine on their own through licensing or patent sharing. Do you remember seeing Bill Gates, right, saying, no, they won't know how to do that over there. It's not a simple business of making a vaccine. It's very complicated. We make sure of that.
And allowing the recipe for these vaccines to be shared would be helpful. And do you think that would be helpful?
No.
That's because at the root of the Pfizer model are a set of intellectual property rules laid down in trade deals. These effectively allow big pharma corporations to operate as monopolies with no responsibility to share the knowledge they own however much society needs it. Pfizer's chief said it was dangerous to share companies' intellectual property. Who for? Us? It has been claimed that 100 factories and laboratories around the world could have been making vaccines but have been unable to do so because they cannot access patents and recipes like those held by Pfizer. So we get to the heart of the problem. We are told the vaccines are good, the vaccines are necessary. Good. Can we get them over here in these poor countries? No. Well, hold on. Wait. Are they good and necessary or not? Well, it's complicated. You don't understand this because you're not properly educated and you're a conspiracy theorist. Are you in QAnon? There are those who will argue that while large pharma companies do behave ruthlessly, we must accept it because the service they provide, inventing life-saving medicines, is so crucial. But this doesn't hold. Companies like Pfizer behave more like hedge funds, buying up and controlling other firms and intellectual property rather than traditional medical research companies. The truth is, they aren't the sole inventors of the vaccine. That was the work of public money, that's your money, university research, funded by your money, and a much smaller company, Germany's BioNTech. We made some vaccines as well. Shut up, BioNTech. As one former US government official complained, the fact we call it the Pfizer vaccine is the biggest marketing coup in the history of American pharmaceuticals. Well done. A Stat News analysis in 2018 concluded that Pfizer developed only a fraction, about 23% of its drugs in-house, and a US Government Accountability Office report the previous year noted that the industry model is increasingly to simply buy up smaller firms that have already developed products. Oh wow, like big tech. That's capitalism though, isn't it? You see a smaller company, you buy it up, you monopolise, I get the deal. This allows them to monopolise that knowledge and maximise the price of the resulting medicines. Pfizer has channeled $70 billion to its shareholders directly through dividend payments and through stock buybacks. This dwarfs its research budget for the same period. So what kind of company are they? What do you think determines their business model, their conduct and behaviour? What happens out front and centre, the smiling face of Pfizer, or the actual business model that underwrites their profit? To unilaterally condemn as misinformation any inquiry around mandates and vaccines, for me, requires that you ignore just blatant information like this around Pfizer or like other videos we've done around Johnson & Johnson. This is not about whether or not the vaccines are effective. This is not what we're discussing. We're saying, is it legitimate that people would have questions when there is in plain sight an attitude of profiteering? And profiteering isn't a dirty word. If that's your ideology, that is literally the function of the business. Surely you can see these cracks are big enough to allow for the gas of an argument to enter this space. To put today's figures in context, the world's most lucrative drug in any single year up to this point was Humira, which treats autoimmune diseases and which generated its owner, AbbVie, $20 billion in 2018. Humira was studied by a US congressional committee and is a classic case of how big pharma companies work today. Buy up a drug that's already been invented, patent it to the hilt, and increase the price 470% over its lifetime. That's why there's so much talk in your country, America, about stabilising and fixing pharmaceutical prices, because this business model is effective. It isn't about ingenuity and great research. It's about finding a drug, patenting it, monopolising it, controlling its price, exploiting the consumer. As I've told you many times before, because Julian Assange said it, the function of government is to take public money, your money, and filter it into private interest. And the pandemic, and I have no opinion on the legitimacy of any of this stuff because that's even if I did have one, it's legally complex, but you can see how it fits into that model. Public money filtered into private interest. And you can see here what Pfizer's priorities are. This is not expressing an opinion on the vaccines, the efficacy of vaccines. What I'm saying is their business model appears to be more focused on profit than it is on health. Corporations like Pfizer should never have been put in charge of a global vaccination rollout because it was inevitable they would make life and death decisions based on what's in the short-term interests of their shareholders. Yeah, that's pretty obvious, isn't it? That you do need a distinction between the interests of private companies and the interests of ordinary people. Now, I suppose the commercial and capitalist perspective on this is no. Big business requires that you make products that people really want or need, and then capitalism will take care of itself. But that's not true in a situation where a product might be mandated. That's not true in a situation where a company like Pfizer can buy up smaller companies, monopolize it and control the pricing and can profit in the way that's been listed and delineated in this article. That's irresponsible. It's irresponsible to put Pfizer in that position. So this isn't about the efficacy of the vaccines or the necessity of mandates or any of that stuff. This is about granting undue power to private interests in a matter that concerns everybody. We need to dismantle the monopolies that have handed these financialized beasts such power and instead invest in a new network of research institutes and medical factories around the world that can actually serve the public. That's a good idea, isn't it? You're sort of told, no, there's no other way. Well, of course there is. You can decentralize it. You can put the process in the hands of scientists. You don't have to have science as a subset of big business. You can have science as its own independent entity, researching effective medicines responsibly without the constant imperative for profit underwriting everything they do and biasing the process. When that's so obvious, why is it not happening? Let's have a look how your country, America, is governed. At least 11 senators and 34 representatives held shares in 2020 of COVID-19 vaccine manufacturer Pfizer. There you are. I mean, the pandemic's been terrible, but my stocks have, by coincidence, really benefited, so that was nice. Lawmakers held these investments in COVID-19 minded companies as Congress was at the center of the pandemic relief efforts. Congress also authorized more than $10 billion to help drug companies develop and distribute vaccines and forced health insurers to cover the cost of getting the shot. Elsewhere on this channel, we talk about how consistently this problem occurs. Congress folk owning shares in companies that they're supposed to regulate. Pfizer spent substantial amounts of money lobbying the federal government in 2020. Pfizer PACs and individuals who work for the pharmaceutical giant contributed more than $4 million to candidates and committees in the 2020 election cycle. Added to this, Pfizer has kicked off the new year by hiking the prices of more than 120 of its drugs, resulting in significantly higher costs for patients amid a pandemic. So there you are. You don't need to query or question the efficacy of the vaccines. That's not something we do on this channel. It's complicated. You know that, and I know that. But what we can observe transparently and plainly is that the benefits Pfizer accrue from having the power they do is irresponsible, that new models are required as delineated and outlined in this article, and certainly you can understand why some people might think that there are motivations other than public health and the good of ordinary people in operation and in effect within organisations like Pfizer, because it's plain as day that there are. Why are the government and the mainstream media spending so much time and energy trying to censor, control and shut down the host of a popular podcast when there's evident need for inquiry and conversation and transparency around this issue? Who's got more power, Pfizer or Joe Rogan? Who has more impact on public health, Pfizer or Joe Rogan? So these are legitimate questions, and the suppression of those questions and the censorship of those questions doesn't lead to a more favourable outcome and more trust in institutions. It leads to the exact opposite. But that's just what I think. Tell me what you think in the comments below. Tell me how you'd like to see these situations change. If you enjoyed this video, have a little look at this one or this one. And please sign up to my mailing list where I'll inform you exactly what I'm up to. For example, I'm live all over the UK between March and May. You can come and see me. Stay free.